So what else can I do? You know, I'm doing all these things and I'm still concerned my horse has risk, or I'm doing these things and I know my horse still gets disease. Hopefully there's been some additional tools in the talk that beyond just the very sort of simple approach, that there's some nuances that we can work around, that you can adapt, but there's other things that we can do as well. So this was a study I did about, this one was published, I can't remember, about 2014 or something like that. It was a study I did for another company, and this is how I actually ended up with Kelato, because Kelato were not involved in this research. It was done independently of them, but Kelato have picked this up, and it's one of their cornerstone products that they're going to talk to you about in a second. And so what we did in this study was we looked at a combination of apolectol, which is pectin and lecithin, brewer's yeast, Saccharomyces, and magnesium oxide in these horses. And what we saw was, when we looked at the squamous disease risk, we had these horses are horses that had been treated with omeprazole, and these were race horses under extreme sort of risks because of their sort of natural environment that we've talked about, or unnatural environment that we've talked about. And what we saw was that we were able, with the treatment group on the left-hand side, when we took them off omeprazole, which they had to be 2 or less to take them off, we took them off omeprazole, and when we treated them, their risk didn't change over the next 28 days. Whereas if we put them on a placebo, their risk of disease increased. And we saw a large number of those horses develop ulcers, and we saw a lot of those horses develop very severe ulcers. So, so we saw a clear benefit of treatment here, which is good, but we also know that if we do a lot of diet things, we can reduce the risk of squamous disease. Where I personally got really excited about this research, and where I think it has a really big utility, is in glandular disease, where we have such a limited ability to impact risk factors. We need another tool, and I think that this comes in, you know, as another tool that we can use to manage those at-risk horses, or horses with a history of disease. So again, we see the glandular grade, we see no difference with treatment, and we see that they worsen, not just in terms of the number that worsen, but also we saw some very, very severe lesions in the horses that were on the placebo group, whereas the vast majority of horses in the treatment group didn't change, or if anything, actually went down slightly with treatment. So, you know, that's a really positive outcome. And at the time, we were really struggling for tools for gastric ulcer syndrome, and we had for a long time. And I actually came across the GastroAID in Horseland one day, and, you know, was really excited to see it as a commercial product, because I think it's something that can really make a difference to the management of our horses. And as a result of that, I ended up chatting with Kelato, and here we are talking about gastric ulcers. So significant effective treatment there, something that I think is really valuable in our toolbox, and something that I have my own horses on. I have horses that have had a history of disease, and also horses at risk of disease, as well as having horses that, you know, my clients that have a history of particularly glandular disease. You know, this is a product that I actually use quite a lot.